Let's take back control with the right plan and the right team. Endometriosis has a way of making life feel fragmented, with pain on one side and fertility questions on the other, often handled by different doctors who are not always in sync. The most meaningful progress happens when surgical care and fertility care are aligned from the start. Carefully removing disease can reduce pain, restore anatomy, and either improve the chances of natural conception or optimize outcomes with treatments like IVF. Just as important, recovery from surgery today is far more manageable than many women expect. With minimally invasive techniques and enhanced recovery strategies, most of my patients are up and walking right away and easing back into normal routines within just a week or two, guided carefully to rebuild confidence and function. Have you been feeling stuck between symptoms, specialists, or fear of what comes next? Schedule a consultation, and I can help bring everything together into one clear, forward-moving plan built around your goals and your life.